Hello.
Hello.
My name is Dr. Punekar. I'm your MRCP examiner today. This is Station 1 Neurology. Would you like to come through, please?
Yes.
This is Mr. Waddington. He has been referred by his GP for a visual disturbance. Please examine his eyes neurologically.
Hello, Mr. Waddington.
Hello,
My
nice
name
to
is
see
Kareem.
you.
I'm one of the doctors.
Right,
I've been asked to examine your eyes, if that's okay.
that's all right with me.
Okay. Can you see me at the moment in front of you?
Yep.
Okay. I'm going to ask you to cover one of your eyes for me, sir.
Right,
Okay. Either eye's fine. Okay. Can you see how many fingers I'm holding?
2,
Okay. And now?
4,
Excellent. And could you cover your other eye for me, please, sir? How many fingers now?
4,
And now?
5.
Excellent. Thank you very much. Do you normally wear glasses, sir?
Only for reading, driving the car and watching television.
Okay. I would like to use a Snellen's chart to formally assess his visual acuity.
Okay, that's fine. You can go ahead without it.
Okay. Thank you very much. Okay. Now I'm just going to test the movement of your eyes, if that's okay.
Right,
So, if there's I'm just going to come to your level.
yep,
Okay, and I'm going to ask you to look straight at me while keeping your head still. I'll ask you to follow my finger with your eyes, okay, and let me know if you see double.
right,
Okay, so please follow my finger with your eyes.
double. 1, 1, 1, 1, still 1, 2,
Two. Okay. Can you look again at? You see two.
still 2,
Okay. I'm going to cover this eye.
right,
Okay. While you're looking at my finger, let me know which image disappears. If it's the nearer one or the one further away from you.
neither yet.
Neither. Okay.
Not yet, the one nearest to you has disappeared.
The one nearest to me has disappeared. Okay. Thank you very much.
Is that it?
Not yet, sir.
Oh,
But it does indicate you have weakness of one of your eye muscles.
right,
I'd like to complete my examination by examining your eyes further, if that's okay.
yep,
Okay. I'd like to look at the reflexes in your eyes in response to light. I'm just going to shine a light in your eye, looking for the response.
right,
Okay. We shouldn't cause you any harm. Okay. But you will. Some people experience some discomfort.
okay.
Okay. Shining the light now.
Do you want to follow it?
No, no. Just look straight ahead. Thank you. Thank you. Thank you very much for your time, sir.
All right,
To complete my examination, I'd like to do a fundoscopic examination.
Okay.
Ideally, do Snellen's chart assessment as well
Okay.
as time allows, Ichihara color assessment as well.
Okay.
I've completed my examination of this patient's eyes from a neurological point of view as requested.
Thank you. Would you like to present your case, please?
Yes, I was asked to examine Mr. Waddington's eyes from a neurological point of view. My diagnosis is a left-sided abducens nerve palsy.
Okay. So would you like to present your positive findings during your examination? What are your findings?
My positive findings are that the patient experienced diplopia on left-sided lateral gaze, and on covering the right eye, it led to obliteration of the more medial image.
Okay. Good. Would you like to tell me what your findings were on your pupillary reflexes assessment?
Yes, I found that his pupils were bilaterally quite narrowed. However, we are in a bright room, and they were both equally responsive to the bright light.
Okay. Do you think in a patient who has presented with diplopia and who has ophthalmoplegia on assessment, do you think it's important to know what the pupillary reflexes are?
Not specifically. because if he, for example, had signs consistent with an oculomotor nerve palsy,
Okay.
that would be more relevant.
Yeah, that's good. So a patient who has presented with ophthalmoplegia, it is relevant and important to test the pupillary reflexes. What findings do you think you might have in a patient with a oculomotor nerve palsy?
So
Pupillary
Patient-
findings.
pupillary findings, well, the oculomotor nerve supplies the parasympathetic nerve efferents to the eye, so they're responsible for pupillary constriction. Therefore, a lesion of this nerve will lead to dilatation of the pupil, as well as a ptosis.
Okay, good. Would the pupil then react to light?
The pupil would not react to light.
Absolutely, yeah. Okay, that's good. Let's just come to the finding that you have had in this gentleman. So you say that the patient has a left abducent nerve palsy. The patient started with double vision all of a sudden 3 days ago. What diagnoses or what conditions might lead to this presentation?
Well, a sudden onset neurological deficit would make me think immediately of possible stroke.
Good. Okay. Would you like to add anything more to it? What area of the brain do you think is affected here, and what type of pathology are you expecting here?
Well, anatomically, the nerve, the abducens nerve, has a very long and irregular course throughout the brain before it reaches the eye. So it could be anywhere between the midbrain and the eye itself.
Okay.
So it's quite a non-specific sign. Generally, it can be a false localizing sign as well, and you'd have to rule out other causes.
Okay. Well, you mentioned about the midbrain. The third nerve nucleus, the oculomotor nerve nucleus, is present in the midbrain. Where do you think the abducent nerve nucleus is located?
It was my impression that it arises from the midbrain as well. However, I may be mistaken.
Okay. Right. Can we just progress on the sort of on the discussion around the abducent nerve? Which muscles of the eyes does the abducent nerve innervate?
The lateral rectus muscle.
Okay. Is that the only muscle innervated by the abducent nerve?
Yes.